on the floor or on your bed with a pillow underneath your head for increased comfort. Of course, you can do this without a pillow. Tap into your lateral costal breathing, which is breathing through the sides and back of your rib cage and also your pelvis. Lift one leg up, wrap your hand around the knee, and then bring the knee more towards the center into internal rotation. Take note of how this feels. What do you feel and where? Connect to the breath, staying present, thinking about expansion through the bottom of the rib cage and the back of the pelvis, down to the sacrum. Keeping your breath smooth and consistent, I invite you to rock yourself side to side. And moving into our second stretch here for 5 breaths. Grabbing hold of your foot, applying gentle pressure to the foot, pushing the knee away gently and rocking side to side as you breathe, opening through the pelvic floor. Notice tension in your jaw, your head, and your face, wiggling your toes, finding your spine on the floor. Wonderful. Noticing the pelvis on the floor as you release that leg. Is there any change in sensation? If so, where? Try not to analyze what you're feeling. Just feel it and take note. Notice any tension change in your body. Going on to the other side now, going into internal rotation, pulling that knee across, finding that foot on the floor, taking deep breaths into the back of the rib cage and the pelvis, thinking about opening through that back body, noticing any thoughts of coming up, saying, am I doing this right or wrong? Just knowing that staying here is nourishing and improving blood flow to the tissues and relaxing through the back and the pelvic floor. Giving yourself permission to rock back and forth. We're not thinking about pulling that leg aggressively. We're just looking to increase blood flow. Going into external rotation, pushing that knee away, grabbing hold of that foot, noticing any tension changes in head, face, neck as you're doing this, or in the upper back, and staying connected to breath. Wonderful. Notice your pelvis on the floor. If there's been any change, grabbing our ball, placing underneath the pelvis now. Now rocking side to side, just exploring this ball. Moving in the pelvis in a way that feels good. I invite you to time your movements with your breath. So as you rock one way, and again, there isn't a right or wrong way, we're just applying biofeedback to the pelvis. Breathe in, and then as you go the other way, breathe out. Invite fluidity and variability of movement into the practice here. Taking the ball away at any time if it feels right for you. But if possible, stay here as you roll that pelvis gently. Notice if the mind is wandering, or if you're able to stay present. Removing the ball. Again, comparing the pelvis. Grabbing both knees, rocking side to side. Give yourself a break from your breath and just invite some play into this movement. rocking and massaging that back. Wonderful. Compare your pelvis here, again, taking note of any sensation changes. And we're going to lie onto our tummy, placing our elbows close to our sides, rocking our pelvis back and forth, finding your elbows under your shoulders. Keep breathing. I'm just adjusting here so you can see my profile a bit better. Pushing through the elbows like you're punching through the floor for your inhale, keeping your neck relaxed, and then letting go for your exhale. Punching through the elbows for your inhale, and letting go and relaxing that pelvis for your exhale. Continue on and off with that inhale, exhale in a way that works for you, just noticing tension. Wonderful. Lying back down on the pillow, finding your pelvis on the floor, noticing any difference with that baby cobra. Picking a leg up again, we're going to compare that internal rotation from when we started. Notice any change in how far you can go into that internal rotation, and connecting to that breath again for 5 breaths here. Only a few minutes left in this practice. You're doing so great. And after the last breath here in this internal rotation, we're going to couple with external rotation, just like at the beginning of the practice. Grabbing your foot, noticing any difference here. It might feel exactly the same, and that's okay. Just taking note, rocking side to side. Just knowing doing this practice over time is the goal. Witnessing and staying present with our body and kind with our body is the goal. And then we'll slowly start to see those symptoms change. Comparing the other side into internal rotation, connecting to the breath, that back body expansion through the back of the rib cage, the back of the pelvis, being kind to ourselves if you're feeling, am I doing this correctly? It takes time and patience to start to have the interoceptive ability of what is happening with our breath. Just focus on the contact points on the ground, expanding into them, the sides of your body expanding away, and then on that exhale, thinking about just relaxing that whole body. Beautiful. Rocking side to side, inviting any movement into your body to help release tension. Noticing, are you being kind to this hip? Are you connecting gently? What is your intention? Wonderful. Noticing that pelvis now. Connecting to your breath. Let's do a couple gentle bridges. Of course, you can just rest. But if we're feeling any low back tension, sometimes a couple bridges can be really nourishing. You don't have to go high. Opening those hands up for a few more breaths here. And relaxing, exhale, finding a moment of gratitude for the work that you have done today. Take care.